I'm going to introduce my next speaker, Dr. James Wright of Calgary. James Wright is a graduate of Ohio State University. I like to think that Ohio State University is remembered for two things. It is usually the best college football university in the United States. It's a place where those who want to go into professional football head, because if you come from Ohio State, you know you're going to be at the top of your game. And then the second thing is James Wright. He was a graduate there in medicine and in history of medicine, and he has a named lecturer there now. But James has done many things. First of all, he became a researcher, and one of the things he was very interested in was the physiology and the pathology of the islet cells of Langerhans, how pertinent to our discussion today. And then he headed out further simultaneously in the medical history, and he has really got into the insulin story, and particularly MacLeod. He's really followed up on what Michael Bliss started and has been absolutely successful in making compelling cases for the MacLeod role. He's been honored with the Osler Medal from the American Association of History Medicine. He's a vice president of that organization. He's a fellow of the Osler Society. Maybe that's where you're vice president. And he's an exacting researcher, very willing to give frank opinions. He will speak now on Frederick G. Banting, a great idea pursued with dogged determination, precipitated the discovery of insulin. Please welcome James Wright.
Thank you, John. So in 1982, Michael Bliss published The Discovery of Insulin. Prior insulin histories had highlighted Banting's. Actually, I'm going to have to read off of here. I have cataract surgery the week after I get back, so.
James, you can read this.
Yeah. Oh, okay. Yeah, I can actually see that. Thank you. So each promoted a fairy-like tale Banting and Best myth that a young war hero surgeon with a novel idea and a medical student discovered insulin while working unsupervised in a University of Toronto physiology laboratory while the laboratory's director was on vacation. All suggested that the discovery occurred at the time of Banting and Best's first positive laboratory results in August 1921. Bliss's The Discovery of Insulin showed that others had been on the brink of discovering insulin, and that would distinguish the Toronto team from its predecessors was the successful treatment of Leonard Thompson on January 23, 1922. It established that there were 4 discoverers and that the roles of MacLeod and Cullip had not only been previously underestimated by historians, but had been actively suppressed by Banting and Best. In 1984, Bliss published Banting, a biography which provided further vital details. Frederick Banting had his great idea on the night of October 31st, 1920, while preparing for a medical student lecture. He read a paper by pathologist Moses Barron that obstruction of the pancreatic duct causes the exocrine pancreas to atrophy, but preserves the pancreatic islets. It occurred to him that ligating the duct could destroy the digestive juices while leaving the pancreatic internal secretion intact. Banting took his great idea to J.J.R. MacLeod, professor of physiology at the U of T, who was an internationally recognized expert on carbohydrate metabolism. Banting was a farm boy who had graduated from U of T Medical School during World War I and then had served heroically overseas. He would likely be said to have dyslexia today. He had been a dogged rather than outstanding student. He had only limited research experience, none of which was applicable to the problem at hand. His manner was awkward and taciturn, but his awkwardness was counterbalanced by stubborn determination. McLeod must have been immediately known that Banting was poorly equipped to take on such a project, but he agreed to help. McLeod was an experienced supervisor, and he tried to instill cautious realism into the discussion, but Banting merely resented it. Banting wanted to work part-time while maintaining his clinical practice. McLeod agreed to supervise the project, but only if Banting would work full-time for 2 months. Banting was indecisive, but 4 to 5 months later, he agreed. McLeod provided research facilities and reagents, student assistants trained to perform biochemical testing, both Charles Best and Clark Noble, and over a dozen dogs. Banting and McLeod's study design was simple. Banting, assisted by a student, would ligate pancreatic ducts in dogs and then would wait a few weeks for the exocrine pancreatic atrophy with preservation of the pancreatic islets to occur. Banting, assisted by a student, would perform pancreatectomies in other dogs to induce diabetes, which would be confirmed biochemically by a student assistant. Diabetic dogs would be treated with either grafts of duct-ligated atrophic pancreas or by injection of extracts made from duct-ligated pancreas. Treated diabetic dogs would then be monitored clinically and biochemically for improved diabetic control. The experimentation began in mid-May 1921. McLeod left for Scotland a month later. A coin toss determined that Charles Best would assist Banting for the first month and that Clark Noble would assist for the second month. However, because of the long learning curve to become a competent surgical assistant, it was agreed that Best should continue for the rest of the summer, which sidelined Noble until McLeod returned. So Banting and Best generated evidence for the existence of what they called iletin over the summer of 1921. Their success was made possible by recent advances in biochemical testing made elsewhere. These included state-of-the-art blood glucose and other biochemical tests that McLeod had taught Best and Noble. While objectively their experimental results were mixed, Banting and Best became totally convinced they had discovered insulin in late August 1921. McLeod returned from Scotland on September 21st. He considered their results encouraging, and he immediately suggested additional experiments and controls which angered Banting. McLeod also suggested that Banting and Best needed to read the literature and that they should begin to write up their results for publication. Banting and McLeod agreed that maintaining a depancreatized dog on pancreatic extracts could help solidify their results. Banting believed that previous investigators had been unable to isolate the putative antidiabetic internal secretion because it had been destroyed during extraction by the powerful pancreatic proteolytic enzyme trypsin. However, Banting's great idea was wrong, as student physiology textbooks clearly stated that its precursor, trypsinogen, is inactive until it reaches the intestine. McLeod was always careful to give Banting full credit for the idea that initiated the sequence of events in Toronto, but not for the discovery, which was the work of his team. Banting recognized that making insulin from duct-ligated dog pancreas was impractical, precluding future clinical application. So Banting decided to make extracts from fetal pancreas, which he had now read was islet-rich and lacked mature exocrine tissue. Banting, although working in a meatpacking city nicknamed Hogtown, chose fetal calf islets because, and I quote, "Having been raised on a farm and being familiar with stock breeding, I knew that cattle are frequently bred before fattening in order to make better feeders. There would be therefore plenty of fetal calves available at the abattoirs. So it's now known that fetal mammalian pancreas is an exceedingly poor source of insulin, but there are two exceptions: mid-gestation fetal calves and lambs. Fetal calf pancreata at the gestational ages Banting used possess numerous insulin-rich giant perilobular islets, which explains the high potency of his fetal extract. This islet population mysteriously disappears at birth. So fetal bovine pancreatic extracts helped keep a depancreatized longevity dog alive for 70 days. This immediately led to purification of insulin from whole adult cow pancreas by call-up. Therefore, Banting's second great idea was much better than his first. So this slide shows the microscopic appearance of 5-month gestation fetal calf pancreas, and the insulin is stained for brown. And between the bold arrows, you can see these large islets that are full of insulin and disappear at birth. So in 1922, diabetes mellitus was believed to be primarily a chronic disease of adults. Childhood diabetes was believed to be exceedingly rare, and so Toronto's Hospital for Sick Children did not have a diabetes ward. Since the Toronto General Hospital diabetes ward was limited to treating adults, Leonard Thompson's family pretended he was 14 to gain admission. So a few weeks after his admission to the Toronto General, 13-year-old Thompson was the first diabetic patient to receive an injection of pancreatic extract in Toronto. He was not selected because he was young, but rather because of his immediate availability and because he was near death. Thompson received an extract produced by Banting and Best on January 11, 1922, which had limited effect and caused a sterile abscess. On January 23rd, he received a more purified extract produced by call-up, which brought him back from the brink. With this success, Banting's role had effectively ended, as his surgical skills were no longer relevant. Differential expertise were needed to scale up the production of insulin, to understand its physiological action, and to introduce it into clinical practice. His sense of vulnerability was heightened by a growing belief that MacLeod and Collip were conspiring to steal his glory. He physically assaulted Collip on at least one occasion. He threatened to throw MacLeod out of a window on another. Banting abandoned the work for the month of March 1922, sulked in his room, and resorted to drinking lab alcohol. When Best finally persuaded him to emerge, he did so to discover that he was well on his way to becoming a national hero. However, tension grew, and the Banting-MacLeod controversy was damaging to the university. In September 1922, Colonel Albert Gooderham asked Banting, Best, and MacLeod to each provide him a written summary of the events leading to the discovery. Each did. While this approach did not resolve their differences, it worked out well for Banting. Banting's story was quickly circulated by his friends Billy Ross and Belvian Henderson to the press, as well as some influential politicians. This resulted in the Ontario government establishing the Banting and Best Chair of Medical Research at the University of Toronto, with Banting as its permanent holder with a generous salary in May 1923, as well as the Government of Canada awarding a lifetime annuity in June 1923. Banting was now wealthy and could pursue research on any topic that interested him. He was also busy clinically treating diabetic patients with insulin. MacLeod's version of the story was suppressed by the U of T for over 50 years and was only revealed after the last of the discoverers had died. Despite his virtually unchallenged rise to fame, Banting's hatred for MacLeod became increasingly virulent. The tension came to a head with the joint award of a Nobel Prize Banting was so upset at MacLeod's inclusion that he had to be talked out of refusing the award. He accepted but refused to share the platform with MacLeod. Famously, Banting generously shared his award money with Best. MacLeod followed suit with Collop. Banting was at his best when he didn't feel challenged, and the children he treated have happy memories of him. Banting was cursed by a habit of falling out with colleagues, and yet despite the blemishes, he was a decent, dogged man who threw himself unstintingly into everything he did. His misfortune was that he was poorly equipped to live up to the expectations he had fostered, but he worked resolutely, next trying to cure cancer. As a colleague said in 1924, and I quote, "So much adulation has had a bad effect on Banting and made him very unhappy," end quote. Another colleague noted that he is, quote, "now obsessed with the idea of doing something big by himself so that no honor will go to MacLeod," end quote. So it's ironic that Banting, who desperately wanted the glory for the discovery, hated the adoration and public responsibilities that came with being worshipped as a Canadian hero. Sadly, he never achieved another success in research. However, Banting found consolation in outdoor activities and took up painting, for which he showed considerable aptitude. Banting enlisted at the beginning of World War II and served as a Canadian research liaison with the UK. He died in an airplane crash in February 1941. The story unearthed by Michael Bliss is compelling. Four men stumbled unwittingly into the pantheon of fame. Banting's personality was vital to his success, but became a major handicap afterwards. Best's role as a student assistant trained in laboratory techniques was equally necessary. Collop's chemistry skills allowed the clinical validation, which differentiated the research in Toronto from all prior work elsewhere. MacLeod's quiet stewardship made it all possible. The lives of millions of people have been transformed, yet sadly, success did not bring personal happiness to any of the discoverers. The discord was so great that the four discoverers were never photographed together. This is the only photograph of even three. In summary, Banting would not have discovered insulin without MacLeod, as he lacked the expertise to pursue his idea on his own. MacLeod would have not made the discovery, as he had mostly moved from carbohydrate to acid-base research. Both were necessary and neither was sufficient. So the Nobel Committee got it right when they selected them as co-recipients, although a cogent case could also be made for Collop's inclusion. Current historians of insulin generally agree that Banting's initial great idea played no essential part in the discovery, other than that Banting and Best's promising findings convinced MacLeod to focus his laboratory's efforts on the purification, physiological characterization, and eventual clinical application of insulin. Banting apparently never appreciated that his great idea was irrelevant to the discovery, and that he and Best spent 4 tiresome months during the summer of 1921 trying to work their way around a non-existent problem. Thank you.